My name is Dr. Howard Austrager. I'm a chiropractic physician. I've been practicing in Framingham since 2000. Now I'm going to jump right in and talk about peripheral neuropathy. Peripheral neuropathy describes disease or damage to the nerves that run throughout your entire body, except the brain and the spinal cord. These are the nerves that come off the spinal cord and go to every part of your body. It affects nearly 20 million people in the United States. Nearly 60% of people with diabetes have neuropathy. Now, there are many different causes. Now, the most common causes are hurting your back. It causes scar tissue, arthritis, spinal stenosis, bulging discs. Statin drugs can increase your incidence of neuropathy. Poor diet, diabetes, of course, autoimmune conditions, as well as vascular disorders. Now, there's 7, common symptoms that are usually associated with neuropathy: numbness, burning feet, cramping, sharp electrical pain, pain when walking, and difficulty sleeping because of this, leg discomfort. Now, there are 3 types of nerves that can be affected: motor nerves that control your muscle movement, sensory nerves that transmit sensations, kind of pain, hot and cold, light touch, vibration. There's also autonomic nerves that regulate kind of internal body things, breathing, your heart rate. Now, depending on what nerves are involved, there's many different symptoms that can happen. You could have muscle weakness, painful cramps and twitching, muscle loss, your bones can degenerate. You can have skin changes, to the sensory nerves. Now, it really depends, which nerves are really involved. You might have a problem, kind of telling difference of vibration, your light touch, position sense, kind of where your legs or arms are in space. Especially if you're things like temperature change. You might not notice if you're feeling burned or not. You'll get that numbness in the feet that works its way up, then it could just get to the hands and into your arms. You could lose problems with your reflexes. You can also have a problem kind of maintaining your balance when you get this neuropathy in your feet. Now, if your autonomic nerves are, involved, this can cause, maybe heart irregularities, problems breathing. You might not sweat. Your sweat may be too much or not enough. Problems going to the bathroom. An inability to maintain a normal blood pressure, which can lead to dizziness or lightheadedness and even fainting. You can have stomach and gastrointestinal problems. You can have also decreased sexual function if you have neuropathy. Now, your neuropathic pain, perhaps your burning pain, could be seriously affecting your emotional well-being. It may be worse at night, disrupting your sleep. Now, you may be thinking, I told you about neuropathy, but how can I help your suffering? Well, the answer is that I treat you both metabolically and neurologically. We have a great approach to treating neuropathy patients. We have a special treatment program that has, been around for over 10 years that several hundred doctors across the country are using to treat thousands of neuropathy sufferers. Now, my program is great for someone who is concerned about the side effects of prescription drugs, or for someone who has tried the prescription drugs and, is not satisfied with the outcome they've had thus far. Now, before I put together a treatment plan, what I do is I run in-depth tests and conduct a thorough neurological examination just to determine exactly what's causing your neuropathy. Now, what we'll do metabolic is I'll do sensitivity testing about gluten, soy, dairy. We do a complete metabolic panel. I check your lipids. We do a complete blood count with autodifferential. I do an adrenal stress index. We'll check your immune levels. Something called intestinal permeability. You might check your hormone panels as well as the thyroid. All these different things can have to do with your neuropathy. Now, after I get all these test results, I analyze the results and we formulate a specific treatment plan just for you. Now, your specific treatment plan may consist of a combination, of some of these different therapies. We may do oxygen therapy. We do something called brain-based therapy. We might do spinal decompression, alleviate some of the nerves. We'll offer dietary and lifestyle changes. We're going to give you glutathione, which is the most potent antioxidant there is out there. And as well as we do necessary nutritional support. Now, once I run all the necessary tests to determine your specific condition, I can treat you via my neurological and my all-natural nutritional protocols. Now, please review this website where our testing and treatment methods are described in more detail. This website is full of life-changing information and talks about what makes us different. Now, what makes us really different is that I treat the individual and not the diagnosis. By using my brain-based therapy and specific nutritional protocols, based on your blood and other diagnostic tests. My intent is to help you accomplish your goals. Now, I want you to ask yourself, the following questions. Now, how has your neuropathy affected your relationships, your finances, your family, or other activities? And what does this cost you in time, money, happiness, and even your sleep? Now, where do you picture yourself in the next 1 to 3 years if this problem isn't taken care of? And what is it worth to you if I can improve your condition? Now, what I'd like you to do is please share this information with a family member or friend who also may be suffering, and find it a way that we can end their suffering. Now, what I'm offering is a free consultation and case review to see if you are a candidate for my neuropathy treatment program. Now, this offer is only good for a short amount of time, and currently I can only accept 6 new patients a month for this program. Now, patients who respond sooner can get started, on the road to health faster. Now, I do not accept all cases. I only accept those cases that I truly feel that I can help. And I'm looking for people who are fed up with how they're feeling and are looking for a drug-free approach to getting well. I'm looking for patients who want to do whatever it takes to get better and will follow my recommendations. Now, if you'd like to schedule your free consultation of any additional questions, you can call us at 508-620-1585, or you can send me an email to draustrager@gmail.com, and I will personally answer any questions you have prior to coming in. Thanks for watching, and please look around the website. That will answer all your rest of your questions. Thanks.